Go.
My name is Caroline Mwewa from ADRA, Zambia. We are one of the partners that is working on the Disability Inclusive Disaster Risk Reduction program. We've implemented this program with our partners from 2023 up until now. And so I think from the time that we started, it's been a learning journey for all of us. It's been very interesting for us to see ourselves working in the same space with other organizations, especially organizations of persons with disabilities. Our focus on this project has been to see how best we bring disability inclusion in disaster risk reduction. And when we began this project, I think when it came to participation of persons with disabilities in disaster risk reduction, there were a lot of challenges. There were very few persons with disabilities at community level that were able to participate, simply because I think we had very few or non-existent structures that could allow persons with disabilities to participate. But along the way, there's I think so much that has happened in terms of bringing persons with disabilities on board, providing a lot of capacity building for them, raising awareness on their rights as persons with disabilities, and also just encouraging them to bring out issues that they think are relevant to them as far as disaster risk reduction is concerned, and also to understand some of their challenges when it comes to issues to do with climate change, how they get impacted with the effects of climate change. Most organizations struggle to bring persons with disabilities on board. But through this program, I think we have learned that working closely with persons with disabilities and also their organizations makes it very easy for us to allow for participation of persons with disabilities. We've also seen how government institutions and other stakeholders have also responded to the capacity building that we have been providing. I think we have interrogated a number of issues related to disaster risk reduction strategies. One of the issues that we have interrogated is our early warning systems across the 3 countries that are implementing this program. And what we have concluded is that we still have a long way to go because our early warning systems are still not very accessible for persons with disabilities. And it's interesting for us to see that there is a lot of interest from partners to see how best we can put our heads together and come up with early warning systems that are accessible by everyone. The other aspect I think that I want to share is the aspect of resilience building for persons with disabilities in the context of climate change, especially when they're affected by disasters. Most of the programs or interventions would basically target persons that do not have disabilities. But I think in this program we've been able to see how people with disabilities are also able to build their resilience when they are targeted and also have their capacities built. We have seen, for example, through the self-help groups, how these people with disabilities have been able to mobilize their own resources within their communities and come up with some initiatives that have assisted them to build their economic resilience. We still have issues that we think need to be addressed, especially at policy level. We see that most of our policies are very silent on persons with disabilities. For example, for my country, Zambia, where I come from, we do have the national disaster reduction policies in place. But then when you look at these policies in detail, you find that there's very little that is being talked about when it comes to persons with disabilities. Here and there, the policies will talk about inclusive, but not very explicit in terms of how that inclusion will be realized. We've also looked at issues of how our governments can also materialize aspects of disability inclusion in DRR. And I think that has been one of our biggest areas of advocacy with our partners, ZAFOD, to see how best do our governments begin to materialize some of the issues that we are trying to suggest. We have learned a lot from each other in terms of best practices. Quite a lot has happened with how persons with disabilities are now able to mobilize themselves, how persons with disabilities are able to work with other people that do not have disabilities, and how the project has sort of given some form of dignity to these persons with disabilities. So for us, I think this was a good pilot project with so many lessons that we have learned, so many best practices that we could share, that other programs can also try to adopt. So for me, I think it's just to say that if we could get all these best practices, the lessons that we have learned along the journey, and then see how best we can use them for future programs, then we'll begin to see that the participation of persons with disabilities will become even more effective. And we can also reduce the impact of climate-related disasters for persons with disabilities. May I state that for most people, I think the challenge comes in when it comes to working with persons with disabilities. I think because of lack of awareness, it becomes challenging for them to really know how to engage with persons with disabilities. But I think as you work closely with institutions that are focused on persons with disabilities, you begin to understand that it's actually very easy, because now you are aware of what are some of the issues that affect persons with disabilities. How do you engage? What are some of the acceptable things that you can do together with persons with disabilities? It even goes to simple things like the language that is used in the disability movement. It looks very simple, but I think it's very important when you're working with persons with disabilities. And those are some of the things that have made it, I think, easy for us to work with persons with disabilities on this project. We still experience a lot of climate-related challenges which are affecting persons with disabilities. But I think with the capacity building that we have provided to the communities where we are working, we are hopeful that we will see persons with disabilities being less impacted compared to the past because of the knowledge that they have received, and some of the linkages that have been provided for them to be able to access certain resources that can help enhance their livelihoods.